Managing the worry associated with a diagnosis or concerns about the future, and we did touch upon that earlier, it can lead to anxiety and fear. Why is it important for patients to share any worries they may be having with their care team?
Well, I love this question. It really wraps up everything we're talking about here. I believe that part of the journey for the patient does include mental and psychological safety. And so it's very difficult to make major life decisions when one is not feeling mentally, psychologically safe. And so that's what you're hitting on here. Anxiety, fear, worry, of course, a natural and important part of the patient journey with any cancer, much less a rare cancer and a blood cancer on top of that. But sometimes in some patients, it can become so paralyzing, so overtaking and overwhelming that it may prevent the ability for the patient to receive information, process it, and then make a decision back. Yes, we want people to have caregivers, power of attorney, all those things are essential, but we also want people to have their own agency and aegis. And so I would approach this from three aspects. And I really love this question because I don't think we were addressing it as head on 10, 15 years ago. One aspect is the disease itself. These MPNs, systemic mastocytosis, eosinophilia, myelofibrosis, PVET, all of these MPNs can secrete these cytokines and granules that can really mess up the patient's mindset, even just profound fatigue leading to a slowing down of the neurological process. So I think underlying control of the disease is something that can affect this. Number two is the side effects from some of these medicines. Interferon is a great example, a wonderful class of drugs that's been around for decades, treated for solid and liquid tumors, but it has a known side effect of causing brain fog. Some of these issues can even cause depression, anxiety in some people. So education, mitigation, following these things with dose reduction, that's an important part. A third aspect, Catherine, is actually looking with a counselor and a therapist on the spectrum of this. So normal, adjustment disorder, depression, for example. And what we've had as a breakthrough at our center has been the supportive palliative care team. They've been phenomenal. So this is a group of doctors who's kind of 1/3 internist, 1/3 oncologist, 1/3 psychiatry support. And so rather than the usual consults that we used to do, either to psychiatry or to social work case manager, there is this burgeoning field of supportive care medicine, which has revolutionized the care, I think, particularly for solid tumor patients and now hopefully for our blood cancer patients. So I'm able to refer patients for a variety of reasons. There's a fatigue clinic for overwhelming fatigue. There is obviously depression, anxiety support, either with medications, talk therapy, or both. Smoking cessation for folks who are still smoking and maybe either withdrawing or quitting is causing stress. So it's a really cool science. And if your center has that, that's something to inquire about. And then lastly, as we've mentioned, a nice running theme today, Catherine, is looking for other medical stuff outside of the MPN. I mentioned thyroid earlier. Remember, you have a thyroid abnormality that can cause fatigue, depression, anxiety, right? So what's your TSH, thyroid function, vitamin deficiencies? Screening for your other well person screening exams, looking for solid tumors, looking for other conditions that may be mimicking the MPN or mimicking one of your other aspects. And so again, it comes down to partnership with the primary care team and looking at that. So I think those are some of the aspects that I want to mention, but it's such an important part of the journey. Really, really have to mention that as well.